The things that society has told us are normal, like leaking after pregnancy or painful intercourse, any of these things, just because it's quote unquote common does not mean it has to be the norm.
Welcome back to the Sensible Mama podcast. I am Paulina Westcott, your host. Very happy to be with you today. Before we get started, please don't forget to subscribe to the channel if you haven't already. Like this episode, and please share it with a mama that you think may benefit from the information we cover today. So today we are talking about something that I honestly don't know much about. I didn't know that pelvic floor health therapy problems were even a thing until after I had my second baby, after which I started doing much more research. I found out that there's this whole subject that I have not been exposed to. So I have so many questions. Very excited for today's conversation. My guests today are Mariah and Brittany. They're pelvic floor therapists here in Connecticut, just a few towns away from where I am. Really excited for today's conversations, ladies. If you want to introduce yourselves, kind of tell us a little bit about what you do, why you do it, and then we'll jump into the whole thing.
Okay. Thank you for having us. I am Brittany. I got my doctorate in physical therapy from Quinnipiac University, and I started in outpatient orthopedics, and then about a year in started to specialize in pelvic floor PT, took some courses on it, realized how helpful it was for so many women and how hard it was for them to find therapists that treated that, and so just ended up going full force into the pelvic health world.
Very cool.
And my name is Mariah. I'm a PTA, so a physical therapist assistant. My background is predominantly in dance and yoga, and then I found my way to physical therapy and decided to go back for the second degree, and just having already had my bachelor's, the doctorate seemed a little too daunting, so I decided to do the PTA program. And then Brittany and I come from the same work environment. We worked together in an outpatient orthopedic setting, and then both went and did our pelvic floor trainings and some further continuing ed with pregnancy and sexual wellness, some things in that regard. And yeah, what Brittany said, we both were just very passionate about it. And the more we did it, the more we talked about, okay, like maybe we could go out and do this on our own. So enter rooted embodiment.
That's amazing. So cool. So I guess the first question, the lowest level of understanding necessary, what the heck is the pelvic floor?
Valid question.
So the pelvic floor is the pelvis, the abdomen, the low back. The muscles within the pelvis are what we consider the pelvic floor muscles, and they have a bunch of different roles. So things like supporting our pelvic organs, core and pelvis stability, control of your bowel and bladder, sexual function, and breathing is a really good one as well.
So just like a couple of minor aspects of living, basically.
Exactly, yeah. Because there, like Brittany was saying, there's, your pelvic floor musculature, and it's almost like a bowl at the base of your pelvis. But there's a lot of examples of almost like a soda can, like your whole center, your whole trunk is like a soda can, and it kind of moves in tandem with your breath. So your breath is a huge part of your pelvic floor, and definitely something we talk a lot about in pelvic floor PT.
It's very, very interesting. So obviously my podcast is geared a lot toward pregnant women, but before we dive into the nitty gritty of what to do, what not to do, things that you might want to worry about or get checked out or whatever, kind of as a general stroke, what kind of things do you guys treat or help with or strengthen? What are the conditions? Why would somebody come to see somebody like you?
Yeah, so pelvic floor PT, again, like Brittany was saying, it covers more than just your pelvic floor. It's your hips, it's your pelvis, it's your back, it's your core. But definitely a lot of people, when they think of pelvic floor PT, if they think of it at all, is normally pregnancy and postpartum. There are so many things that pelvic floor PT can help with. Again, like Brittany mentioned, when it comes to like the purpose of your pelvic floor musculature, is your sexual function, your bladder and bowel function. So if anyone is having issues with incontinence, urinary or bowel, like any sort of like leakage, urgency, frequency, that is something you can see a pelvic floor PT for. Pain with intimacy, pain with insertion for like gynecological exams, like speculums, like all these things are also relevant to pelvic floor PT. What else? There's so many things. Again, like hip and low back pain. Brittany, what else?
Like abdominal surgery or pelvic surgery. Any like gender affirming care surgeries. Yeah, there's a lot.
Yeah. So it's interesting you mentioned surgeries because, you know, I think of a vaginal birth, right? Like there's obviously strain and pressure on the muscles on the very bottom because that's where the action happens. That's where everything is going, right? But it's interesting that you also mentioned, like, if somebody has a C-section, what would be some things that they would, like, experience, or what are some of the things that they would have happen that they might need to see a pelvic floor therapist for?
So still definitely very important. A big one is scar management. So working on like the mobility of the C-section scar because adhesions and stuff will form. Working on like core strengthening because your core stretches so much, and even though you didn't have a vaginal delivery, your pelvic floor muscles still lengthen and weaken just with the hormones that change during pregnancy.
Right. That makes a lot of sense.
And even if somebody had like a C-section like years and years and years ago, like one of the big takeaways from one of our classes that we took is like no matter how old a scar is, like you can work on it. Like
I just learned this. It was just a few episodes ago. I had on a woman from Vancouver. She is a massage therapist, but she really does a lot of work with specifically, like she does a lot of work with postpartum moms, but very specifically with post C-section recovery. And I was like, okay, like this is an interesting episode for somebody who's about to have a C-section or just recently went through one. And then in the course of the episode, she's like, listen, it can change, like you can still make a difference to your core health and everything going on down there years, even decades afterwards. She's like, I've had people who like suddenly start doing some sort of exercise, or they hit menopause or something, and they realize that things are shifting and they don't feel right, and there's actually something that can be done about it, which I thought was so, I mean, first of all, it's just a testament to the human body. It's just incredible what it's capable of doing and healing, and the way that it all works is just incredible. But I thought that was really heartening for somebody who, you know, maybe, I mean, I imagine it's probably the same for a vaginal birth too. Like if you had a baby years or decades ago and you're struggling with discomfort, you know, during intercourse or incontinence or something like that, is it ever too late to see you?
No, never too late.
Never too late. And again, even like in regards to like scar tissue management, like again, even if you have a vaginal birth and you have some tearing, like it can potentially, you know, it'll heal, but it can also still cause discomfort with intimacy. It can be tender to touch. So like that's something we can work on pelvic floor PT as well, to not only decrease the sensitivity of it, but again, like connect it into the things that may be causing other issues like the pain with intimacy, etc.
Interesting. Very interesting. Yeah, see, this is all new to me. And it's funny because, you know, I was very into birth. I did so much research into birth. Which is great, you know what I mean? Like, better than not preparing at all. But the whole postpartum thing, I just thought, I don't know what I thought. I guess social media or Hollywood or societal expectations or whatever set me up to think that postpartum was just going to happen the way it happened, and there wasn't anything to prepare for. I was woefully wrong. There is so much to know from so many different angles, which is why I love these kinds of conversations on the podcast where it's like, okay, let's like really dive into it, right? One of the things that, okay, I'm just going to ask the question because we might as well jump into it. I was told Kegels are all, you know,
Kegels
almighty.
are king.
They are king, and if you're not doing them, you're doing yourself a disservice, and you're going to regret it later. And so what did I do? What the internet told me to do, of course. And now, now I'm 4 years after having my first kid, and I'm following all sorts of, you know, professionals in this space. Mm-hmm. And suddenly it's the exact inverse, where Kegels are crap, and if you do them, you're destroying yourself. And so I have questions. Teach me, what's the deal with Kegels? To do, to not do? Are they going to kill me? Are they going to save me? What's the deal?
It depends.
Yeah, it depends. There's a time and a place for Kegels. It really depends on the person. So that's why like a pelvic floor assessment is really, really helpful. Some people have weakness of their pelvic floor because their muscles are overactive. And if your muscles are overactive, you don't want to do a Kegel. We need to get those muscles to downtrain and relax. But some people's pelvic floor is weak because it's weak, and they do need to do Kegels and build up the strength and endurance of those muscles. Anything you want to add, Mariah? There's so much on Kegels.
I know. The Kegels, I if you like see anything on Instagram, it's like the Kegel to the beat challenges and like all the Kegels
I've
things
seen this
online.
girl. I don't know if you guys have seen this one girl. She's like, and pull and release. And now pull and pull and pull and release. And I'm like, this
You're
is
like,
just
oh my God.
weird. I don't know how I feel about this. Like, I don't want some stranger on the internet telling me what to do with my hoo-ha down.
Yeah.
Not doing it.
Exactly. Yeah. So there again, like it's super dependent on person. It's like any other form of exercise, right? Like it just because one person could benefit from one thing doesn't mean another person might. But when it comes to pregnancy, again, it you would think, and a lot of people will tell folks who are about to have a baby to do Kegels and strengthen the pelvic floor so that when it comes time to push, you're able to do that effectively. But
that's exactly what I was told.
Yeah. So, and we've had people in the past where it's like they were so tight that when it came time to give birth, they couldn't relax their pelvic floor.
Wow.
And they were just holding and couldn't actually do the pushing effectively. So it's a mixed bag. You want to be strong so that you can do the pushing, but you also want your pelvic floor to lengthen and relax so that baby can come out.
That makes a whole lot of sense.
A lot of times we've also found that when somebody is pushing and they think they're pushing and they should be bearing down and opening everything up, they're actually Kegeling and tightening everything up. And like she was saying, that can make birth a lot more difficult because you're fighting against your body and tightening everything up when really you need to be pushing out and letting everything relax and go.
So interesting. So, okay, so obviously, and I would expect you guys to say that the solution is to go see a pelvic floor therapist. And I, knowing what I know now, I would agree with you. But knowing women, myself included, sometimes we don't take that kind of advice. So, aside from seeing somebody like you who can like really do a deep dive into, okay, where are you? Like, what does it look like now? What do we need to do? Do you need more, less, whatever? What are some things that a pregnant mom can do to prepare herself for birth? Like, are there safe exercises, stretches? Like, what advice would you give to a woman who is trying to prepare her pelvic floor and her abdomen for this marathon coming up ahead?
So exercise for sure. Like I feel like one of the myths that, obviously has changed in, more recent times is that if you exercise, it's going to cause harm or it's going to make you go into labor faster or, what have you. It's going to benefit you. It's going to decrease your risk of a lot of things. Gestational diabetes. It's going to make birth easier because you're going to be stronger. You're going to hopefully be, able to relax and do all these things that you have to do. So exercise for sure. Brittany, what else you got?
Perineal stretching is one that I have all my pregnant women do. So perineal stretching will teach them around 35 weeks. And all you do is you use your fingers or your partner's fingers. They can do it with you. Make sure you have clean hands and lubricant available. And And what you do, so if the vaginal opening is like a circle, you are going to be on your back and you're going to insert your fingers and stretch down towards your anus. And you can hold it for like 60 seconds. You would feel something like, people describe it as like a tingly numbness. It shouldn't be super painful. If it's super painful, you're going a little too aggressive. But holding into that for like 30 to 60 seconds, really focusing on breathing and relaxing into that. What that does is it stretches the tissues, the perineum, gets everything ready for to stretch when you're going to have a vaginal delivery. And doing perineal stretching has shown like lower rates of having to have an episiotomy, reduces your risk of tearing by a good amount. And it just makes the woman feel more confident to go into the birthing process. They've also found this is interesting, that having intercourse during your third trimester can decrease the risk of pelvic floor trauma, because during intercourse, everything is stretching.
Interesting.
Yeah.
Very interesting. So you talk a lot about breathing. That seems to be a word that is coming up a lot. So this is something that, like, I don't know, I remember, so I ended up having diastasis recti after my first kid. And I remember I was learning about, some exercises that you can do, and she's like, you lie on your back and you put your hands like this and then you breathe. And I'm like, come on, lady, like, get to the real stuff, right? Like, I got it.
I know how to breathe. Yeah.
I was laughing at that part of that episode.
Since you saw that, yeah. I've been breathing since the day I came into this world. I know how to breathe, woman, And I didn't. I was doing something else, and I wasn't fully utilizing my breath in the right way to support my body. And I don't know if that was the reason that I tore, the reason that I had DR or whatever, but it is this theme that is now coming up, which, I don't know, like, let's talk about breathing. In pregnancy, in birth, you talk about it with regards to the core. Like, you think of breathing as something that happens up here, but what does it have to do with your pelvic floor?
Let me get on my soapbox.
Yes, I love it.
So, again, like, my background's in yoga, and then even before doing any of my pelvic floor trainings, it was like, okay, like, how can I talk about breathing to all these people that I'm making exercise and PT? But it's huge. It's a huge component of what you're doing, regardless of what exercise. Like, if you think about people who are doing like heavier lifting, like, that's going to play a huge role, especially like postpartum, and you're going back to lifting and you're trying to do these things. And if you're having all these changes to your pelvic floor, and then you're increasing your intra-abdominal pressure by not breathing correctly or holding your breath, this is going to cause more problems, possibly leakage, etc. But again, if I wanted to get on my soapbox,
go for it. We've got time. Absolutely. Let's dive into it. I want to hear it.
I mean, societally, women, we're constantly focusing on how we look, what our stomachs look like, and then when you are wearing tight clothes, that's going to restrict your breathing. If you're trying to breathe more up into your chest and into your ribs instead of into your belly because you're trying to suck your belly in, that's also going to change. And again, I do it all the time too. Like, I need to remind myself constantly throughout the day. But the fact that, like, we go through our days without even, like, subconsciously, we're just holding our belly in and we don't even notice. And then it's like, oh, wait, okay, if I soften into my belly, like, my breath is going a different place in my body. Like, that's changing how things are feeling. And again, your whole torso is like a canister. It, like, moves in tandem, your pelvic floor and your diaphragm. So it's a huge connection. So when you take a breath and your diaphragm moves, your pelvic floor moves with it, and exhale again, vice versa. But it's a huge connection. It's going to be a lot of changes in pressure in your abdomen, putting a lot of force on your pelvic floor. So that's why breathing is so important when it comes to exercise and focusing on your pelvic floor. And like Brittany was saying, when it comes to stretching, you want to make sure that you're breathing and relaxing and settling into your body, and you're not, going into a fight or flight stressy area. So yeah, it's a huge component.
It's interesting that you say that because, and this is something that I talk about a lot, is the difference between my two labors. So with my first, and it was more in my head than it was in my body, but it was affecting my body, right? Like, so every contraction would come, and my mental sort of reaction was, oh, here it comes again, right? Like, okay, we're going to make it through this one. And it didn't, like, at that moment, it didn't feel like that fight or flight reflex. But it also wasn't the other thing. Do you know what I mean? So I was like, there was a resistance to this impending contraction. And I was like, oh, here we go. And I would tense up, and then I'd have to remind myself to relax. And it was like this like effort that I had to make. I did a lot more practice preparing for my second kid. I practiced breathing, where every night when I went to bed, I did the exercises. I really like worked on, okay, breathe the right way, right? Like, we'll go back to the sucking in the belly thing in just a minute, because I think that's also really interesting. But what happened was, when it came time to give birth to my second kid, I was like, let's go. Let's do this thing. I'm excited for the contraction. I know that it's productive. I know that it's going to be intense and it's going to be uncomfortable and may not feel good, but I want to like dive into it rather than tense up and like bear up against it, right? If that makes any sense. And so it was a lot easier for me to just move with the contraction. And I was like doing weird positions. Like I was all over the place. I am not a gymnast. I am not a particularly flexible person, but the contortions that I was doing in the middle, like sitting on the toilet, holding my husband's hands, my legs were like up on the washing machine and my knees up on the sink, and I'm like, I don't know what I'm doing, but this is what feels right. And I was breathing. That's working. And I'm telling you, it was intense. It was fast. It was such a fun labor, which is like, who says that, right? It was wild. And then my baby flew out of me. I had no tearing. I had fetal ejection reflex kicked in. I didn't push. In fact, I was trying to not let him out because I really was determined to have birth in the water. And he was like, Nama, I'm
He's
good.
Like, we gotta go.
I'm ready. And I was like, well, I guess. I literally looked up at my husband like, is there somebody behind me who's ready to catch a baby? Because he's about to come out. And he like looked up and he's like, yeah. And I was like, okay, cool, here he comes. And then I just like, he literally like in one contraction, head was born, water broke all over my poor midwife. Sorry, Karen. And body came out all in one contraction. And I was like, what?
Fast and furious.
That's even possible? Like, I had heard these fairy tale births, right? And I was like, yeah, okay, we all know that that's like exaggeration. It was legitimately just like amazing, right? But I don't think it was an accident. I don't think it was because it just fate had me in its graces that day. You know what I mean? I don't think it was. I think it had a lot to do with the fact that I had prepared and that I had practiced breathing. And so just kind of to give a specific, very real life example to what you were saying, it is so important. You know, don't write it off like I did the first time as I know how to breathe, you know.
But you're right, because if you come into PT or whoever it is that you're seeing and they're like, all right, let's do some breathing. You're like, okay, well, I know how to breathe. I do it all the time. Right. So that's a valid thought. But yeah, then you break it down and it's like, okay, well, like, where are you breathing? Like, where is it going? Like, are you breathing more up into your chest? Like, these are all things, again, that you don't think about. And then when you break it down.
Could you do, like, this is going to sound silly, a breathing 101 real quick? Like, just take a few minutes and, like, break down what are the yes, no, what are the recommended tools you can use, practice you can do?
So we'll often tell people, like, we'll have them lay on their backs if they're a little bit more relaxed to start at least, but you just like simply put your hands on your belly and try and kind of breathe into your hands almost, so you'll feel your belly rise and fall. And again, other parts of you are going to move, but if you tried to send your breath like up into your chest and didn't move your belly, that's kind of what it feels like when it's maybe not doing the thing it's supposed to do. But if you just kind of put hands on belly, breathe into your hands. Britt, you got any more breathing tips?
Yeah, breathing in through your nose and out through your mouth is really good. Don't want to be like a mouth all through your mouth. A lot of people can just be mouth breathers. So I usually do like the what is it, smell the roses, blow out the candles. That cue can be helpful for people.
How long would you say to exercise? Like if you're going to lie down and practice breathing, as silly as it may feel, you lie down on the floor, how long should each breath be? You know, you don't want people to hyperventilate either, because I remember I tried to follow along with the video and I'm like, I can't do this anymore. Like, how is she taking a breath in that long? And over time it did become easier, but do walk me through that.
So like, if I were like teaching a yoga class and I wanted to be more of like a relaxation, like down training the nervous system kind of thing, I normally tell people to make their exhales a little bit longer. So if you say breathe in for 4, breathe out for 6, and you can again kind of change those numbers, because you were saying, you're like, oh my gosh, like how is she still taking a breath in? Like that's that's the opposite of what we want to do.
Right.
But yeah, trying to make your exhales a little bit longer can definitely help with like that, like decreasing stress. Another thing that is it's a weird cue, but like Brittany gave the in through the nose, out through the mouth, kind of that visual is sometimes helpful for people. It's a weird cue, but it's helpful to relax the pelvic floor if you think about breathing into your butt.
Yeah. I mean, it sounds hilarious. It sounds very silly. But I understand, like, specifically when it comes to labor, like, people are like, send your breath to your vagina. And I'm like, when you first hear things like this, you're like, these people are doing drugs. Like, they're saying absolutely things that are just completely bananas. Send your breath to your vagina. What is that? Like,
yeah.
And the first time you do it, you're like, oh, what? I'm not sending my breath to my, I'm not sending it I'm sending it out of my mouth is where I'm sending it, right? And so it does take some repetition, you know, and like just don't just try it once and then give up on breathing. Like it's important enough that trust these ladies, they do know what they're talking about, you know what I mean?
And just starting with like a minute or two is perfect, and that's better than not at all. And then gradually like increasing how long you do it is good too.
I was just looking up this book. I think the breathe into your butt or breathe into your butthole I got from Alicia Jeffrey Thomas. She wrote Power to the Pelvis, and her Instagram is delightful and fun if you want to follow any like.
What's the name again?
The book is called Power to the Pelvis.
Okay.
But her Instagram, her name is Alicia Jeffrey Thomas. She's a pelvic floor PT out of Massachusetts, and she's like hysterical. She's got some good visuals if you're a visual person.
Definitely writing that down, because I love following anybody and everybody who's got things that I can learn from. All right, so we talked about breathing, but I do want to bring it back to this sucking in your gut, right? You were saying that, and I remember, so I'm a millennial. I don't know if kids these days are, you know, going through the same experiences that we did back in the day. But back in the day, it was all about low-rise hip jeans, crop tops.
Well, those are coming back.
Great. Not for me. I'm past that phase. My belly has grown twice. I grew an entire man in the day 2 times.
Man.
Yeah.
They came out big, and my belly gets. I'm not doing crop tops anytime soon, and I'm okay with that. I'm fine for the next generation to take over that. But that being said, in the early 2000s, back in my day, it wasn't even that we were taught. It was just what you did. You sucked in your belly real tight, and you walked around like that all damn day.
Yeah.
And so when I remember I got pregnant, I was 29. And I remember, you know, I'm like early pregnancy, you know, belly's not showing or anything. I'm starting to near the second trimester. I'm still not showing, but like definitely changes are happening. And I'm like trying to, you know, button my jeans or whatever. And I'm like, and I remember I like let my body just go for a second. And I was like, whoa, what was that? I forgot what that felt like. And I had to untrain myself, because you can't do that when you're pregnant. You can't suck in your belly the entire time. your poor child, you know what I mean?
Yeah.
And I had to like consciously reverse this habit that I had formed over my teens and 20s. That's like decades of doing this, which is just crazy. And maybe that's the reason I got DR. I don't know, you know? Let's talk about that. Like, obviously, Instagram has these beautiful skinny models with their, you know, washboard abs and whatever. It's easy to say that you don't care about it after the fact. Like, now I legitimately, I'm like, cool, whatever. I'm fine with high rise and my body did something amazing. I'm not looking for a tummy tuck. I don't care. But when I was 18, 19, in my 20s, I did. And so maybe just a little bit of education. Like, why is that something that we should avoid?
Do you want me to get back on my soapbox?
Yeah,
Please do. I love your soapboxes so far. Let's go.
Again, it's like you're saying, it's like you have to kind of like reteach yourself. It's a constant like unlearning. You have to, it's something I still do. Like I have to remind myself, but to the opposite end of the low-rise jeans, Brittany and I were talking about high-waisted stuff the other day, because that's also like, again, if you're wearing something that's high-waisted and it's really snug, like that's going to be restricting your ability to relax your belly, and it's digging into you.
No.
I know. Wear comfy, loose clothes. But yeah, it's hard. It's hard. So it's just kind of like, okay, when like in spaces that you feel comfortable, that maybe it's not like gonna, you know, mess with your mental well-being, because obviously that's a key part of it too. Like whether it's just like every time you go to the bathroom, okay, like can I just stand for a second, relax my belly? Or like when you're at home, like you're probably going to be more relaxed when you're at home versus when you're like out in public. But yeah, it's just a lot of unlearning and a lot of reminding yourself.
But from a mechanical perspective, why is it bad? Because you would think like, oh, maybe it like tones the ab muscles. Maybe it's maybe it's a form of exercise. Like this is the rationalization, not being at all trained in physical therapy or anything like that. That was kind of well, maybe it makes sense because I'm making my abs stronger. Maybe I'm being more toned or whatever. Like from a mechanical perspective, why should we let it go every now and then?
Well, I mean, the breathing thing. So again, if you're tightening, you're not going to be breathing into your belly. You're going to be breathing just more from your chest, and your diaphragm is lower down, which is your main breathing muscle. So it needs to be able to expand. And then just keeping everything tense all of the time, like tightening your abdomen, probably like tightening your glutes, causes things to be overactive. And then you can see a lot of pelvic floor issues because of that too. And it increases like the pressure down there, which can lead to a bunch of other issues like prolapse, that type of stuff.
Like Brittany was saying, it's like that pressure management part is huge, because if you're not allowing the canister to breathe and move, it's just going to increase that pressure in the abdomen. And like Brittany was saying, it's going to put pressure on your pelvic floor, which can cause issues down the line. It's not like it's all going to happen at once, but again, like prolapse, leakage, and again, like any sort of tightness, like if you are clenching your glutes and you don't really realize it, like that's going to probably lead to some discomfort in some capacity down the line. So it's one of those like overflow things.
It's interesting, like the more I learn about the body, the more I learn about birth, postpartum, I mean everything, honestly, is like, it's a very annoying thing, because it's not like there's one answer to everything. It's not like you do one thing and it's the thing that's going to fix it, or it's the thing that's going to guarantee you an answer. It's like this, you have to be kind of fluid, right? Like there's a time and a place for more exercise, but then you need to listen to your body. And if it's time to like chill and not do so much strenuous exercise, you know what I mean? Like it's not like there's one thing that is always going to be the right answer, is kind of what I'm getting here too, right? Like,
yeah.
It's very individualized, it's very personal, and it changes for one body throughout the different chapters of your life, right? Like a woman's body goes through so many different chapters, potentially, right? Like there's pre-puberty, puberty does all sorts of shenanigans on the inside. Then as you're developing, if you get pregnant, you know, that is a whole freaking different universe. Then there's the whole pregnancy. Then there's giving birth, which is like its own thing, postpartum. And then if you get pregnant again, and then, you know, rinse and repeat as many times as you have a baby. Menopause and perimenopause is a whole subject that I haven't delved into, that I'm sure we could probably do an entire episode on. But there's so much to know, and I'm like, come to the point where at this point, if you want to talk about soapboxes, one of my most common ones is you have to trust your intuition. You have to listen to your body. You have to treat it individually. Like, what worked for me may not work for you. What works for one person isn't guaranteed to work for the next. And what worked for me the first time may not work for me the second time, because today my body has gone through different things and I've experienced different things and my circumstances are different. And so it's like you really have to assess now, today, what is my, you know, and get the information, right? Like, it's great talking to somebody like you where you're like, okay, there are things to know. Like, there's actual information and studies and so forth, but at the end of the day you have to take all that and apply it to you today, now, what's happening now, right?
And I think too, like, one of the big things, like you're saying, like, trust your intuition, like, especially with like anything that is going to bring you to pelvic floor PT, it's usually something that's like a little sensitive. You probably don't like want to talk to all your docs about it. And I think that's the other like really beautiful thing about pelvic floor PT specifically, is that, and like especially when we set out to like open this new practice, you know, like the hope is that you can feel supported and be able to talk about all the things that maybe feel like a little bit like TMI. That maybe you go to your doc and it's like, well, I'm having pain with sex, and like instead of them just being like, well, that's normal, or well, you know, whatever, like, okay, well, it doesn't have to be normal, like how can we work on this? So I think that's one of the nice things about like whatever brought you in, like there's no such thing as TMI. We got you.
Yeah, no such thing as TMI with us.
I love that. I mean, honestly, so many people in the world, specifically like in my current, you know, birth work world, the conversations are hilarious. You know, like I went to the Danbury Birth Center recently for a little networking event with a bunch of home birth professionals. And you walk in and there's a bookshelf, and it's like a very cozy, homey place. And there's a bookshelf, right? And on the bookshelf, there's like it's not like a statue, but like a little piece of art of a vagina. And you're like, oh, how cute. You know what I mean? Like, you don't do a double take. There's nothing weird about it. There's like a mug there with like boobs and a belly, and you're like, aw, boobs, cute. You know what I mean? Like, and it's very funny because I take that for granted. I just assume that everybody is comfortable talking about these things now.
Yeah.
You know? Certainly I wasn't. I just forgot that there was this other, you know, version of me back in the day that was like, oh, don't talk about fluids. You know what I mean? And now it's like, it's so like, I understand. I do understand. And it's not that you're weird or wrong for thinking that it's taboo and that it's difficult to talk about. It's normal to feel that way. I felt that way. But it's also really helpful to know that, like, there are people out there, this is their world, this is their life, and there's nothing you can say that's going to offend me. There's no question you can ask about birth that's stupid. You know, I talk about poop, I talk about liquids and fluids and blood, and it's like another day at the office, right? It's literally, for you guys that you have an office, it's literally another day at the office. But I do think that I'm glad you brought that up, because I do think it's really important to know that, like, okay, I'm embarrassed, I think that what I'm going through is weird. Maybe it's my fault. Maybe I'm doing something wrong. Maybe it's normal and I'm just making it a bigger deal than it really is. Like, those are all valid thoughts. Those are all completely valid concerns. But you should have somebody that you can voice those concerns to, and maybe they tell you, yeah, you're right. It's totally fine. What's happening is normal and you just need to wait it out. Or, hey, actually, good news. There's something that you can do about this and we can help you, right? Like, we all tend to sort of internalize these things because we're afraid that we're weird or something like that. And I guess another question, actually, while we're on this topic is, what does a visit to a pelvic floor therapist look like? Are you all up in there? Is it exercise?
Yeah.
Like, this is one of those weird questions, but like, what does it look like?
Yeah, so the first visit is a lot of like talking, them sharing their history, us asking a lot of questions, and then us giving a lot of education. And then we do pretty thorough exams. So I do like a general, like musculoskeletal exam of the hip, the back, posture, walking, breathing, of course, like core strength, glute strength, all of that. And then we also would do an internal exam. This is always up to the patient, their comfortability level. We don't have to do it on the first time. We can do it another time. They can bring a partner or a friend with them if it's something that they're really nervous about. But an internal exam is less invasive than going to the gynecologist. We'll like palpate the area externally, the muscles and the structures. We'll check their ability to contract and to relax. And then we do an insertion of one lubricated finger into either the vagina or the anus to check, again, the strength. So do that Kegel, see how long they can hold the Kegel to see the endurance of their pelvic floor muscles. We'll palpate all the internal pelvic floor muscles, see if there's any tenderness, tightness. We can check for any prolapse of the bladder, the uterus, all of that. Yeah.
And then obviously this is going to differ person to person depending on what they're experiencing, what they're coming to see you for. But like, what is a typical care period? So that's the initial exam, but then after that, is it typically like exercises that you give them, stretches? What's the next step typically?
It definitely depends. Like if it's like, so say we have someone who's pregnant and they're coming in and they're, getting prepared for labor. That's not necessarily something like they probably won't need an internal assessment or an internal treatment every single time they come in. But if we're seeing someone who maybe they're having pain with intercourse, and when Brittany did the initial evaluation, she found that there was tenderness to palpation of certain muscles that are usually painful with intimacy. Well, okay, then yeah, we can work on that, and they'll probably need the internal piece a little bit more, as long as that's something they're comfortable with. So yeah, definitely depends. But then there's of course the exercise piece that goes with it. So similar, like if you went to a normal physical therapy session, we're still going to give you exercises, we're still going to give you home exercises, all these things. So it's just more focused to this one area, but similar to what a normal PT visit would be like if you've ever done PT in the past.
Very cool. And then another question I had is, what do you see the most in terms of like pregnancy? We'll focus specifically on my audience. So for pregnancy and postpartum, what are some of the things that you guys deal with the most in those sort of subcategories?
So pregnancy, I would say people come in, I wish more people came in for like preparation just for birth. But usually if they're coming in while they're pregnant, it's because they're having like low back pain or sciatica, like SI joint pain, pubic symphysis pain, that type of thing.
One. Yeah.
And then
what is pubic symphysis? I've heard of the other ones, but not that last one.
So it's the front. The pubic symphysis is the pubic
like,
bone in the front.
Like lightning crotch kind of thing, or is that something else?
That's something else. Yeah.
Okay.
And people get like the pubic symphysis pain and the SI joint pain. The pubic symphysis is like if you were to draw a line directly through kind of where the SI joint is, but it's on the front. Okay. And that happens because when you're pregnant, obviously there's hormonal changes and the ligaments get really stretchy and lax. So there's a lot of just movement and changes there. So I would say that's what we see a lot for pregnancy.
And that's all something that you can do something about, I take it.
Yeah, definitely.
That's so good.
And postpartum, I would say it's more leakage, prolapse, like they'll get pressure and heaviness, painful intercourse. Yeah. Anything else you think of, Mariah?
Even just like people who want to get like back into exercise. Again, if somebody had tearing, then scar management, or C-section scar management. even just like body mechanics, like again, like your body changed so much during pregnancy and now it's changing again, and you're lifting baby and you're doing all these things that, you know, life demands of you, but there's still been a lot of changes in your body. So making sure that body mechanics and getting back to like your normal function and all those things are what they need to be in order to best serve you and your body changes. Core stability, like Brittany was saying earlier, because again, obviously there's been a huge change in your abdomen. And like you were saying, diastasis recti too, like if you've had any of that change there, or that pulling apart, that separation, that's something that core stability work through PT can help with as well.
And it's interesting because I would have never thought to call you for something that's up here, right? Like the test is done right here, and I'm thinking pelvic floor is like way down south. And so I think it's really cool to know that, I mean, hello, you know, everything is of course connected down there, and it's all part of one cohesive system that does depend on the other areas around it. But I think it's really cool to know that these are things that a lot of moms deal with, you know what I mean? Like, and some of us were like, I'm just going to do it myself. I'm going to find some woman online who's going to yell at me to breathe. And it was good. Like I did fix my DR and stuff, but it probably would have gone a lot faster, and it probably would have been a lot less of a headache had I gone and reached out to a pelvic floor therapist at that time. And in retrospect, I'm like, that's definitely what I should have done, because it took me like 6 months to recover the first time and really feel like myself. And I was like, you know, my midwife is like at 6 weeks postpartum, she does her test and she's like, everything looks good. And I was like, cool. Doesn't feel great. Like, sex is not the same as it was, you know? And, you know, after some time, everything kind of went back to normal and it's fine. But I think that 6 months is a long time to be dealing with that. And I was like, and I was all up in my head about it at that point. I was like, am I wrong? Did I do something bad? Is it just in my head? Like, everybody says 6 weeks and you're fine, which is like such crap.
Truly,
man, this whole you're totally back to normal 6 weeks after you had a baby. I just want to like just scrub that out of existence, you know?
Yeah. I think the really nice thing about, again, most pelvic floor PT places, like Brittany again was saying, like it's so individualized, but the nice thing about what most pelvic floor physical therapy places are doing versus normal like orthopedic places, we have a full hour. We have a full hour one-on-one, which even just outside of PT world, that's not common. Like you're not going to go to your doc and have like a full one-on-one hour with them. So like there are a lot of things that like we know that are going on or that we can possibly see that are going on, and then communicate them to your doc. Like it's really nice, like especially if you have some like a good like team of people during your pregnancy that, you know, we can support with that, because we have that really individualized one-on-one time with folks, or even just after. Like I think when I was listening to your podcast with the woman who had done the C-section massage management, she was talking about like, you know, even though you maybe can't do XYZ up until 6 weeks, like you can still do very gentle things to like recover before that. Like there's like all these like, you know, scary things that can happen in those 6 weeks. Like even though you might be able to go to a pelvic floor PT at 6 weeks and get an internal assessment, doesn't mean you can't go earlier and still get, you know, management and care and exercises that are appropriate for you at whatever stage of healing you're at, and get that support.
I love it. So like one of the things that I'm super passionate about is continuity of care. Like as a birth doula, this is something that I'm like, I go into a hospital and every, you know, so many hours there's a shift change and there's a whole new crew that comes in, and there's this whole new, like now there's this, you have to get to know them and introductions and do they fit, do they like pass the vibe check and so forth. And as the doula, I'm like, I want to be that cohesive, like I am here for you throughout this entire process, pre-labor, for the labor, postpartum. Like I am going to be here and it's going to be me, and I got you, right? And so like I love what you're saying with pelvic floor health is the same thing. You can do it throughout your pregnancy. Then it's, you know, labor does a number on you one way or the other, because it just does, whether it's a C-section or a vaginal birth, it's a whole experience, you know what I mean? But then to already have a relationship with somebody who knows who you are, you already have that rapport and that like because who likes going into a cold doctor's office and being like, peeing in the cup and giving it to some stranger and being a number, and you know what I mean? Like, that was my experience. The reason I ended up with home births is because I was like, I'm just a number here. Like, I'm not a person anymore. And specifically with birth and that whole chapter of life, it's so intimate and it is so personal and it's so beautiful, and it deserves to be supported. Do you know what I mean? Like, it's not just something that you just write off as another Tuesday. It is a beautiful, incredible event. And to have that support team that stays with you and sticks with you, and you can just call and be like, hey, is this normal? Hey, I just saw something come out of me. Is this cool? Like, my baby's doing something weird. Is that normal? You know what I mean? Like, that's how it used to be back before all of this Western medicine and whatever. It used to just be everybody in the village got together and they were like, hey, this is what I'm going through. And all the women would get together and help all each other. And it was like everybody's shared experiences and knowledge. And now we have this benefit of, you know, technology and education and access to information from all over the world, which is great. But we kind of like separated ourselves from that community feeling. And I really feel like it's starting to come back. And maybe I'm just obnoxiously optimistic about everything in my life. But I really feel like listening to you guys talk, like I can see that that is something that you feel strongly about. And I imagine other pelvic floor therapists are the same way. This massage therapist that I was talking to, she was the same way, where she's like, I want to be there for this person going through this thing and continue to be there and continue to support her and not just be like, okay, next, you know what I mean? Like, it is. I love that it's a very personal and warm and supportive sort of role that you guys are playing.
And I think that's like one of the biggest things that Brittany and I talked about when we went out to go make Rooted. It was like, okay, well, whether you're pregnant, just had a baby, are queer, are getting gender affirming, like regardless of why you're coming into our door, like we don't want it to feel like sterile, clinical, scary, uncomfortable. Like we want you to feel safe and supported here. And I think for both of us, that was like one of the biggest things that was important to us. And so that's, you know, something we're continuing to strive for. But yeah, like you were saying, it's a very intimate thing. You don't want to go somewhere where you feel like just a number.
Yeah, I've been there. It sucks.
Yeah.
Yeah, definitely. Well, ladies, this was amazing. I think it was a great conversation. We have a few more minutes. Do you have any closing thoughts, any advice or sort of summary of thoughts that you would give a pregnant mama who's out there listening? Maybe she's having some thoughts, some concerns or whatever. Any final closing thoughts?
Yeah, definitely recommend pelvic floor PT. Staying active, even like if you've been active your whole life, continue to be active through your pregnancy. If you haven't been active before, becoming active in your pregnancy is just as great. Find like someone, say you want to do yoga or Pilates, finding somebody that's certified and can guide you through that can be really helpful. Like most exercises is safe, like walking, swimming, biking, yoga and Pilates, running, lifting, light weights is all safe and really good.
Amazing. Mariah, any final closing thoughts or advice?
We could talk about pelvic floor PT all day. Yeah, again, obviously we're biased. I am a huge advocate for women's health, as is Brittany, and you know, we're happy to chat with anybody if they want to come find us. But yeah, it doesn't, the things that society has told us are normal, like leaking after pregnancy or painful intercourse, any of these things, just because it's quote unquote common does not mean it has to be the norm. So
I love that.
Yeah.
Wonderful. Where can people find you if they want to follow you on socials, or if, you know, if they're local to Connecticut and want to, you know, come see you ladies, where can they find you?
We're located in Middletown, Connecticut.
Yes.
Our website is just rootedembodimentpt.com. What's our Instagram handle?
It's the same, rootedandbindedpt.com.
Yeah.
And on top of, pelvic floor therapy, if maybe that's not in the cards for you right now or financially, we do offer yoga. We have some other things coming up like sex ed bingo, which I will not stop talking about. It's so fun. So yeah, definitely more community stuff as well. But yeah, we're in Middletown.
Awesome.
Come hang.
Yeah, I'll make sure to add links in the description so people can find you. Thank you guys so much. This was such a great chat. I learned some stuff. I hope that our viewers did too. I appreciate you guys taking the time to spend with me today to have this
Thank you for having us.
Thank you. This was fun.
Absolutely. Thank you, everybody, for joining. It was a pleasure, and I will see you in the next episode.